In the early years, the standard of hygiene was appalling. Singapore River was thoroughly contaminated, you can be sure of that.
You'll not be surprised to see a floating dog or a floating pig, dead chickens, right, in the Singapore River, and I'm sure there'll be loads of rats and so forth. Infectious disease then was paramount.
When I first started in the maternal and child health clinics, the health of children and women was very poor.
So there was an outbreak of malaria. Those days, they all consider malaria cases you diagnose are imported cases, mainly from Indonesia and Malaysia, but not Singapore. They're very proud, Singapore, British. No. Suddenly there was a big number of cases. Then I investigated. I began to be suspicious that cannot be, so many cases imported at a fixed period. In a public health department, there was an entomologist, Dr. Chan Kai Lok, and he's retired already. He's a very good entomologist for mosquitoes. So at night time, he will go to the estate, have a mosquito net, and he will stay inside there and let the mosquito bite him. And then he capture the mosquitoes. But one thing I learned, I also followed him, so I also stay inside the mosquito. So it's very interesting. You want to be a clinician, becomes this type of. So he will bring it back and he dissects it, and he found malaria. He and myself proved that it is a local breeding thing. The bosses are very angry with us now because they want to suppress the Singapore thing. But cannot be, evidence is there. Evidence there. So this is one thing I learned when I started public control of diseases. Sometimes you got to dig deep and see, more careful. You cannot say, everybody says important, so easier to say than done. Important, so who cares? But then there's so many people again, you don't care, people are sick.
And I can say that from the very beginning of post-war, public health has improved tremendously, slowly but surely. And it's done a great job in the control of infections. The scourges of infectious diseases declined. We saw the introduction of immunization and new vaccines. And to a large extent, with rising standards of hygiene, good water supply, good food, nutrition, our general standards improved.
And then you could see the infant mortality rate just came tumbling down, and expectation of life improved. The pattern of disease changed from infectious disease to chronic diseases. All the diabetes surfaced, high blood pressure, cholesterol, obesity, sedentary lifestyles, which we now see and which is so difficult to change.
You see, public health is community. Most people think of individuals, but community is important, because if the community is disease, then your whole thing cannot. So this community concept to next 50 years, you must keep it up. So the idea you want to keep it up is prevention is better than cure.
We need to identify the people who have the potential and also who are interested in taking up public health as a career. And having identified, then we have to send them for training.
So when the Swee Hock school was formed, I think I was pleased, because he knew the importance of epidemiology and public health. So I'm glad he donated some of his wealth to the school.
I'm actually seeing now more and more young public health specialists that are going through the residency program, and those that have exited from those residency programs to become public health specialists. Many more actually having that passion. That passion for prevention, that flame.
I think the school can be proud in training healthcare leaders. In fact, not for Singapore only, directors of health, director generals of health in our neighboring countries, they are all alumni of the school, many of them. Professor Lee, now he has trained so many who to succeed him. There are others who can step forward, others which are even better. In fact, I think we should be proud of that.
So I think it's very important that these students get such channels to really explore and pursue something that they have always wanted to or dream of. Without financial aid, they may have other concerns and priorities. I mean, it was a huge deciding factor. What other concerns do I have since I have financial aid? So I will not be able to meet the people that I'm working with now. And I think these are role models that I aspire to be like.
In Myanmar and like in many developing countries, there are a limited number of the public health professionals. So they are willing to take up the degree, postgraduate degree in the public health, but because of the financial constraint, they can't. If we provide fundings for training of the one public health professional, he can save many lives. You never know, you never know.